Good evening. Thank you all for joining us for tonight's roundtable discussion on violence prevention. It's a topic that we all should care about. It's an essential part of our efforts to ensure that we live, work, and study in a community that is safe for all. In the last year, tragic instances of gun violence have profoundly impacted our city, our communities, and our university. The University of Chicago lost 3 students to gun violence last year. Yiran Fan, Max Lewis, Xiaozhong Dennis Zhang. The pain that we have experienced at their loss is what is felt on a daily basis by far too many communities on the south and west sides of the city. We sometimes refer to the university community and local communities. The reality is we are deeply intertwined. We are partners at so many levels. University faculty, staff, students, and alumni live and enjoy enduring relationships with organizations, businesses, and individuals throughout our neighborhoods. Likewise, the university is supported by and relies on local businesses. We work closely with local schools. We partner with community groups on a range of efforts. We are a shared community, and the crisis of violence affects all of us. It's an issue we must address together. Last year, I announced several efforts to augment our efforts in safety and security. These included a substantial expansion of our law enforcement and transportation programs. As a university, we are committed to contributing our strengths in research and education and our resources to work in partnership with the community and the city to work towards common solutions urgently needed to address this most critical of issues. The violence we experience across our city has complex causes, transcending law enforcement-only approaches. There are many root causes and intersecting challenges, including divestment, educational inequity, generational trauma, a lack of access to mental health services. However great the challenge, we as a university have much to contribute in the way of expertise, resources, partnerships, and more. It's important that we bring all of these to bear on stemming the violence that takes place on our streets and impacts our neighborhoods in both the short and the long term. Important work is already taking place across the university to understand and address root causes of violence. This includes research and programs aimed at improving educational practices and outcomes, increasing the capacity of services that connect individuals with employment and economic opportunities, and in support of people who need better access to housing, health, and mental health services. We also have a number of initiatives more specifically focused on violence prevention and recovery. We are going to hear about much of this work tonight. Some examples include the Trauma Responsive Educational Practices Project, which works to develop the capacity of educators and institutions to better serve children from neighborhoods affected by poverty, housing instability, crime, and high incidences of violence. The Education Lab's partnership on the Choose to Change program, which offers support and cognitive behavioral therapy to teens who face considerable challenges, including exposure to trauma, involvement with the justice system, or disengagement from school. The Crime Lab's work on the Ready Chicago initiative, which connects men with cognitive behavioral therapy and job opportunities to help stem the cycle of violence. The Chicago Center for Youth Violence Prevention's collaboration with the greater Bronzeville community to reduce violence and address their critical needs. UChicago Medicine's Violence Recovery Program, which identifies patients at risk of repeat injuries from violence and connects them to hospital and community-based services. And the UChicago Justice Project's work on neighborhood violence and policing. These are just a few examples of the breadth and depth of work that is taking place across the university. I'm pleased to say that each of these examples involves UChicago faculty and staff working alongside partners in the community to combine our expertise, experience, and shared resolve to improve the trajectory of individuals' lives. Yet more is possible and more is needed. This evening, I am announcing our intent to work with our nearby communities to design and launch a new multi-year fund aimed at supporting and encouraging partnerships between university units and community-based entities that advance applied research and improve community-based outcomes in the neighborhoods proximate to the university's Southside campus. From our preliminary conversations and community meetings, some possible areas of shared focus could include social and economic pathways for youth and young adults, trauma recovery efforts, reentry justice-involved initiatives, community-police relations and engagement, and work that helps promote deeper understanding of why some violence prevention programs are more effective than others. These are just initial ideas. The precise areas of focus and other aspects of the fund will be topics of discussion with our neighbors and partners in the next 2 months, with a view to issuing requests for proposals shortly thereafter and issuing our first grants by early summer. Details on the process and timeline will follow soon. These investments will be focused on nearby neighborhoods on the South Side, but their impact will support the entire city. Because the faculty research will be embedded in these community-led activities, we can use what we learn from this work to inform research programs, strategies, and initiatives taking place in other communities, even in cities across the country and around the world. We have convened a panel this evening. It includes university researchers, civic partners, community leaders, and together we will discuss the root causes of violence, the long-term strategies needed to address these root causes, methods that have proven successful to date in Chicago, and what we don't yet know about this multifaceted issue. I'm grateful to our panelists for joining us this evening. I'm eager to learn from them and to hear their perspectives on this issue. We're very fortunate to have Lieutenant Governor Juliana Stratton joining us virtually this evening, to discuss the state of Illinois' efforts to reduce gun violence and improve public safety. The state has allocated $250 million in funding to community groups who are working to reduce gun violence in Chicago's hardest hit neighborhoods, as well as other parts of Illinois facing the ripple effects of the spike in violence. After we hear from Lieutenant Governor Stratton, I'm going to hand things over to Paul Rand, our Vice President of Communications. He will introduce tonight's panel and moderate the discussion for the rest of the evening. I want to express my gratitude to you for joining us tonight and for your continuing engagement on this critical issue. Now, please join me in welcoming Lieutenant Governor Juliana Stratton. Thank you.
Good evening, everyone. I am Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you, President Alivisatos, for that introduction. I'd also like to thank you for recognizing how critical this conversation is and for giving space for our communities that need healing to be at the center of solutions. So, to the Office of Civic Engagement, the entire University of Chicago community, and everyone here, thank you for your work in organizing this event and pushing the conversation forward. Because like so many others, your community is hurting and you want answers. Because gun violence has taken far too many lives from this campus and throughout our city. I would like to take this time to say that I see you and I feel your pain and your concern. I stand before you not just as your lieutenant governor, but as a mother whose children have been impacted by gun violence, as a wife whose husband has been impacted by gun violence, and as a Chicagoan who has been impacted by gun violence myself. I too want to say that I pray for the friends, family, and loved ones of those who you have lost in your community as they are grappling with the immense tragedy of the epidemic that gun violence has caused. But we know that thoughts and prayers are not enough. We remember the ones we lost, we honor them, and we act for them, not just by being reactive, but by pushing forward to be proactive. In November of last year, I joined Governor J.B. Pritzker and leaders across the state, city, and county to announce the Reimagine Public Safety Act, a 4-year comprehensive plan that is investing $250 million in addressing gun violence. We are using data-driven and holistic strategies to approach this problem like the public health crisis it is. For too long, policies have turned to punitive measures that don't address the root causes of violence in our neighborhoods. Instead, neighborhoods themselves and the people in them, mostly Black and brown, have been viewed as the problem, when really we need to recognize that it is the conditions they have inherited that perpetuate violence. We have to look at the decades of harm done by the war on drugs, mass incarceration, and disinvestment, because justice is more than police, jails, and prisons. Justice is also access to health care, including mental health care, educational and economic opportunities, housing and food insecurity, and addressing the lack thereof, and a lack of access to clean air to breathe and clean water to drink. Justice is listening to and making space for the wisdom held in communities most impacted by these issues. It's giving them the support they need to heal and the tools to uplift. That's the spirit behind the Justice, Equity, and Opportunity Initiative, or JEO as we call it, which is housed in my office. It's a first of its kind effort in Illinois, and it serves as a model for the nation's efforts to transform the justice system and promote economic opportunities in communities that are most marginalized by decades of disinvestment and systemic racism. We have dug in and made major strides to address those disparities, from collaborating with state agencies on the Reimagined Public Safety Act to reforming the juvenile justice system. Just last month, we also announced the second round of funding for our Restore, Reinvest, and Renew program, which is also known as R3. In collaboration with the Illinois Criminal Justice Information Authority, the R3 program allocates 25% of adult use cannabis tax revenues into grants for community organizations addressing issues like violence prevention, economic development, youth development, civil legal aid, and reentry after incarceration. We've already distributed $35 million that will support essential programs by 80 organizations and their partners, and applications are currently open for another $45 million to sustain this work. We still have a long way to go, but the way to move forward is on the path that we carved together. Before I go, I will leave you with this. It's easy to feel helpless amid so much grief and trauma, but we all have a role in addressing the systemic issues that hurt us and our neighbors. The truth, this truth, and the knowledge that our communities know best what they need to thrive will guide us. Today's event is a stellar example of that. So thank you to our distinguished panelists for contributing your insights. And thank you to all of you for joining us, for opening your hearts and your minds so that we can all be safe and well. Thank you.
Terrific. Thank you very much, Lieutenant Governor Stratton, for your remarks and also for the state of Illinois' effort to address the epidemic of gun violence. We're now going to turn our attention to the roundtable discussion that we have going on. And what we're hoping to do in the next hour is explore some of the following things. Number one, the root causes of the violence that's facing the south and west sides of the city. We're going to hear about some of the innovative programs that are making a positive impact. And we're also hoping to wrap up with learning more about where some additional programs and investments are needed. I want to flag to the audience that there is a Q&A function that is on the Zoom platform, and so it was not open only to a small group, not to the entire audience online. And we will try to get to some of your questions coming up toward the end. We have an outstanding group of folks that are gathered here, and you may know some of these people already, but if you'll allow me, I'd like to make a very brief introduction. Evelyn Diaz, right to my left, is the president of the Heartland Alliance, which leads the READY initiative. She previously served as the commissioner of the City of Chicago's Department of Family and Support Services, and she's an alumna of the Crown Family School of Social Work, Policy, and Practice. Next to Evelyn is Pastor Chris Harris, who is the founder and the CEO of Bright Star Community Outreach, which is focused on youth and anti-violence programs, in addition to being the senior pastor of Bright Star Community Church in Bronzeville. Next is Deborah Gorman-Smith, who is the dean and the Emily Klein Gidwes Professor at the Crown School of Social Work, Policy, and Practice, and principal investigator and director of the Chicago Center for Youth Violence Prevention. You've already heard from President Alivisatos. Thank you for your comments. Next, we have Valerie Jarrett, who is the CEO of the Obama Foundation. She previously served as the senior advisor to President Barack Obama, where she oversaw the White House's efforts of public offices of public engagement and intergovernmental affairs, as well as chairing the White House Council on Women and Girls. She's also a distinguished senior fellow at the University of Chicago Law School. Jalen Arthur, next to Valerie, is the Director of Strategic Initiatives at Chicago CRED. He also serves on regional violence tables facilitated by the City of Chicago's Office of Violence Prevention and Behavioral Health to improve partnering and coordination across diverse stakeholders in the city. Brenda Battle, next to him, is the Senior Vice President for Community Health Transformation and the Chief Diversity, Equity, and Inclusion Officer at UChicago Medicine. And on the end, right across from me, is Derek Douglas, who's the Vice President for Civic Engagement and External Affairs at the University of Chicago. So thank you all for joining tonight. We have a lot to talk about. And what we're going to do is we have some prepared questions that we're going to start with to allow each of our guests to really share some initial thoughts, and then we'll open it up for discussion. And if I can ask our panelists, don't hesitate if you want to build on somebody's comments, because I think as much of this is a building conversation as sharing, I think it'll be a lot more lively for all of us. So Deb, if it's okay, I'd like to start with you. And you have done a great amount of work when it comes to research on the root causes of violence and the strategy for reducing or preventing violence in the community. And for those who are not familiar with these terms and how they relate to another, I wonder if you could just start by talking about what is the root causes, or what do we mean when we talk about the root causes of violence, and how are we collaborating with our community partners to address some of those issues?
Sure. Well, I first want to say how honored I am to be here in this discussion with colleagues and partners that I hold in such high regard. And I appreciate that the university is bringing us all together. So we've already heard some about what the root causes are from President Alivisatos and from the Lieutenant Governor. Root causes refer to the consequences associated with long-standing racial and social inequities across our communities. And while we know that violence happens in all communities, it's not evenly distributed. And it's concentrated in neighborhoods that, as the Lieutenant Governor said, have for decades have suffered from chronic disinvestment. The consequences of which are seen in unemployment and underemployment, poverty, inequality in education, decreased access to social, medical, and mental health services, inadequate housing, unstable housing, many of the things that we've already talked about. And so we're going to talk tonight about violence prevention and violence reduction strategies. But to take seriously the task of reducing violence, we need to combine these violence prevention strategies with long-term sustained economic and social investment in communities. This isn't something that the university can do alone, but we need to do this in partnership with the city, state, corporate, and civic leaders. And we need to invest over time. We're not going to see these changes in 3 years or 5 years, given the long disinvestment. So I've been doing this work for more than 2 decades. I'm kind of old. And over that period of time, we've learned a lot. We've developed and tested programs and strategies. We've demonstrated, really importantly, that prevention works. We can do things to decrease risk for violence, but we haven't concentrated those efforts in a way that makes real progress in reducing community-level rates of violence. So we know there's not a single approach to this, but we need to have a more coordinated effort focused within communities, moving from a simple or single focus only on individuals to a focus on place, and working in partnership with communities, the people that live in those communities, and those that are most impacted by violence. Just very quickly, and then I know Pastor Harris will talk more about our work. So we've been working to try to do this in partnership with Pastor Harris, funded by the CDC, with UChicago Medicine, the Urban Health Initiative, the enormous support of Dean Polonsky, implementing a collective impact model that's based in a public health approach that uses data to drive community decision-making implementing evidence-based programs that address the community's needs and what the community values and sees as important. Pastor Harris will talk more about this, but over the last 5 or 6 years, we've brought more than 70 partners, maybe more than that, to the table, representing a diverse set of stakeholders from the community, from faith leaders and residents to government and civic leaders, schools, nonprofits, businesses. We've all come together, again, to use data to inform the development and the implementation of a community action plan to reduce violence. And the plan, just a couple of things. It's important that it recognizes the strengths that already exist in the community, builds from those strengths, thinks about the social and economic health of the community as important underlying risk. And with the active engagement, I think at this point of thousands of residents, we've focused in 4 areas: identifying and delivering high-quality programs for youth and families, advancing educational equity for all schools in the community, increasing the resilience of people who are affected by trauma, and providing employment and placement services for residents of Bronzeville. And we're seeing effects, but I'll stop there. And
All right, well, Pastor Harris, she's really teed you up beautifully here. So let me, if I can, maybe direct a question your way. And I wonder if you can talk about how violence has affected the Bronzeville community, and what do you see as some of the most important community-based solutions to violence?
Well, first of all, as Deb said, it's a pleasure to be here with all of you all tonight, and I'm certainly humbled to be here with this esteemed panel. As a son of the soil of Bronzeville, known as the Black Metropolis, where folks who were in the South hoping to leave away from the South and come to the North to a new hope and a new home, and found themselves stuck in what we call Bronzeville. It's pretty amazing that this resilient group of people not only began to populate the area, but they were stuck in an area that they weren't allowed to go beyond, whether it be racism, classism, and all of these other things. It has been a very, very challenging place to not only live, but also grow up. But beyond that, what we found is, as most Black people around the country and world, we're pretty resilient people. And so economically, it has been challenging. Educationally, right? Housing, and all of these other systemic racism issues, the disinvestment, and so many other things. I'll be honest with you, it has not only been a challenge to survive in the community, but also thrive in that community. However, resilient people know how to survive. And we have seen so many different things. I'm 47 years old, and it has been really exciting to see not only the community change, and now we're dealing with what we call development, but if you talk to some people, they would call it gentrification. And we welcome development, this is just not at the demise of the community, and not at the demise of the culture, the rich history and culture in our community. Violence, it has been and still is a big issue. When you think about it, people always ask, well, why is there violence all over the city? And the way I like to make it make sense for people is, I was raised up in the projects in Bronzeville, the Dearborn homes, 2930 South Dearborn, apartment 503, because you were not born in the projects if you don't say the apartment number. That's not good. So the reality is, in the community, you had all of the housing projects in this community. Right? You had from 22nd to 26th Street, you had the Harold Ickes from 28th Street all the way, 26th Street all the way down to 31st Street. You had the Dearborn homes where I was born and raised. From 31st to 35th Street, you had IIT, which Black people weren't even welcome to be on that campus. My brothers and sisters, we used to always get arrested because they didn't want us to be on that campus. 35th all the way to 39th, Stateway Garden, 39th down to 51st, Robert Taylor Homes. And then you had Ida B. Wells over to the east side. And the reality is, if you look at all of the concentrated, the gangs and all of that good stuff that was there in those communities, take a brick and drop it on top of some marbles. what happened? The marbles go everywhere. That is exactly what happened when it came to the gangs and the violence. And a lot of people look at it and say, why is there so much violence? But they don't really look at the history of it. And I think when you think about it, there has to be investment. I still personally believe that the best violence prevention is access to a world-class education and also a great job readiness skills for household sustaining wages and opportunity for entrepreneurship, right? It's great to have the programs, but where is the wealth investment, right? Where's the wealth and investment opportunities for those community members to not only see their community develop, but see their households develop, their bank accounts develop, their opportunities for entrepreneurship being developed? You very seldom see that kind of thing. Trauma counseling, very much so needed. Investment in the various schools. I'll say this and land the plane. One of the most amazing things for me was when my son came home and showed me his school book, and it literally had my name in it. I just want to give you a picture of that.
That's very sweet.
My son, Chris Jr., had my name in his book. That is a picture of the lack of investment, not only in our community, not only in our schools, but in most black communities everywhere. So whatever we'll talk about tonight, and whatever hopeful solutions that we'll come up with, we need to be thinking not only about Chicago, not only about Bronzeville, but for urban communities everywhere. This is a systemic problem. It is seen everywhere, and we need to make sure that we address it when it comes to economic development, when it comes to education, and when it comes to trauma counseling. At the end of the day, we have to make sure we bring healing, help, and hope to these urban communities, or you'll continue to see the same vicious cycle of violence and trauma.
Okay, a lot to unpack with what you've talked about and some big thoughts. And you made the comment that this is, of course, not just a Chicago area question. And so I'm going to actually, if I can, turn it over to Valerie Jarrett, because I think there's a much bigger platform to talk about here. And I wonder if you think about the key opportunities and the challenges, not only in Chicago, but nationally, for public and private partnerships and how those really work and how they might play off of some of the things that Pastor Harris was talking about.
Well, so first of all, good evening, everyone. I am delighted to be here. Thank you, Paul, for the question. And I'll start on a personal note. In Chicago, I grew up in this community. My father and mother both have ties to the university. I raised my daughter in this community. My mom at 93 still lives here, and so her safety is top of mind to mine. And so, President Vasconcelos, when you called and said, would you come, you had me with hello. And I come because, as President Obama said at the groundbreaking, all good things that ever happened to him in life began right here in Chicago. And I do think, as the pastor said, the best practices that we developed, the evidence-based strategies that we developed that have been worked on for a while now through Deb and others at the university will be a template for what we can do around the world. And I am sure when you accepted the job here, you did not think you would be sitting here with us today focusing on gun violence. That probably wasn't top of mind when you accepted this incredible position. But here you are, and importantly, so are we, which shows you the importance of the bully pulpit that the university brings to bear. And I think that the challenges that we have are creating opportunity. And we can describe it in terms of investment, evidence-based strategies, but the whole goal is to make sure that every young person grows up with opportunity so that all of our children can flourish. And that begins, and the pastor and I have talked about this before, at a very early age. Our children should go into school ready to learn. They should be reading long before the 3rd grade. We should be reducing suspensions and expulsions from school. We should be ensuring that kids are not on that path to the juvenile system, which leads right to the adult system. We need these interventions at key points in their lives where we can change the trajectory of their lives. And there are clear strategies for how to do that. And so I'll give you an example of one initiative that President Obama launched when he was in the White House that he's brought home to Chicago, to this community, and that's My Brother's Keeper. And it is, in a sense, coming full circle, because many of you will remember that the inspiration for My Brother's Keeper came when he visited Hyde Park High School at the program there called Becoming a Man. And sitting down with those young men and seeing how that intervention had literally changed the trajectory of their lives made him think we should be doing this on a national scale. We should have programs like Becoming a Man all across the country designed for that early intervention and going as young as we possibly can and continuing that intervention and providing. We talked about safety, but it is also health. And I think you called it to have a public health crisis. This is a public health crisis, and health doesn't stop at some point in our life. It is something we have to nurture all along the way. And so our goal through My Brother's Keeper and the data that we have collected from a national program is to bring here, rooted in the ground in Chicago, the best practices that do change that trajectory at these key points of intervention where we can actually move the needle. And I think part of the reason why I'm so heartened, Paul, that you've gathered us here, as well as the many other organizations that Deb has been working with the pastor, and these relationships that now go back for many years, is because no one of us can handle this on our own.
That's right.
This is a comprehensive approach, and to have the state of Illinois committed to it, the city government, the private public sector, academic institutions with the expertise to develop the evidence that we need so that we're doing what works. And I think the final point I'll make on this is that Deb made such an important point that I would want everyone in the audience to realize is that there is no magic solution that's going to happen like this. And that's why I said it has to be over the continuum of someone's life. We have to decide all of our children are worth this, and that the investment, which costs money, will not only save us money in the long run, but will create a healthier society, a safer society for us all. And so when I think about violence interruption, I like to begin at the beginning of that continuum to say, what are we going to do to create opportunity so that we don't have to put into place the interruption? But until we get to that point, we sure better have organizations like CRED and others who are represented who are saying, what do we do to ensure that along that continuum, everyone is working together and that we have a government that is fair and functioning as well, so our justice system is fair, reimagining policing in a way where we get back to police and those who are in law enforcement be members of the community, not isolated from the community. What do we do to make sure the judicial system is fair, that the prosecutors are operating in a fair way, the people who are incarcerated get a fair chance when they leave our incarceration to re-enter society and get a job and have opportunity? And so if I were to sum up what we're committed to doing in one word, it is opportunity. And so let's get away from, constantly talking about the money that's involved and look at it as an investment. This isn't about spending, it's about investing and creating opportunity.
Okay, thank you for sharing all of that. You talked about this and you used the term that we heard Lieutenant Governor Stratton use, which is public health crisis. Yeah. And we've heard that in a few places. And Brenda, I think with your role with the medical center, as we talk about a health crisis, it doesn't feel like a typical kind of health crisis, does it? It's a little bit right on a different realm. And so I wonder if I can get you to build on this concept and talk about, what happened when you open up the trauma center here on the south side of Chicago through the medical center, and also working with the violence recovery program. How did all that work, and what kind of progress are we seeing with it?
Absolutely, and like my other colleagues here, I want to thank you for this opportunity. This is a really big deal to have this kind of open session to talk about this issue. So in 2018, when the University of Chicago Medicine opened the Level 1 Adult Trauma Center, we had a pediatric trauma center for a number of years, but a lot of the individuals that we see that are impacted by violence in our community actually come to an adult trauma center because the age for adult for trauma care is 16 years and older. So when we opened the Level 1 Adult Trauma Center, we knew that we had to not only focus our efforts on improving the health or addressing the wounds that were created by violent crime and issues that impacted trauma in our trauma center. But we really had to focus also on helping the individual to heal holistically, their physical health, but also their mental health and their social health. And so we developed the violence recovery program in collaboration with a number of community partners, relationships that we'd built over a number of years through the Urban Health Initiative, with the end focus and the framework that violence is truly a public health issue and therefore had to be addressed as a public health issue. And in knowing that, recognizing that violent behavior, risky behavior is actually modifiable, and that if you addressed it through personalized interventions, that you could actually promote healing, and you could reduce violence, and you could reduce the issue, the probability of trauma recidivism. We knew that you could do that, but you can't do it alone. You have to do it with community partners that are already embedded in the community, that are assets to your community, helping your community to actually deliver some much needed support services for individuals who needed that service. But you also had to focus it on addressing the clinical needs of that individual because they're traumatized, they're impacted by violence. So you've got to heal those wounds, but you've also got to impact the social effect of violence on the lives. And also, we also know this from the data, that if you don't have a viable strategy, that 45% of individuals that are violently injured are likely to be re-injured again in 5 years.
45%.
45%, and 20% are likely to die via homicide. So you've got to address this. Also, we also know from the data that individuals that have been violently injured are likely to be perpetrators of violence. And also that the trauma, the traumatic stress from violence impacts that individual in such a way that often they go out and buy a gun or get a weapon to protect themselves, to protect their families, and also often to deal with it just may engage in substance abuse and other issues. So you've got to have a solution wrapped around that individual that's going to interrupt that. So our violence recovery program is really focused on bringing individuals with experience and who've been trained to work with individuals that have been violently injured when they come to the emergency room, capturing them at that moment. We call it the golden hour. That moment in which the individual is most likely to respond to interventions that will prevent them from being re-injured in the future. So very early on, during that hospital stay, we have a team of specialists, we call them violence recovery specialists, that began activation at the minute that an individual comes into our trauma center. At the first thing that they do is they conduct a re-injury risk assessment. And that is because we want to know at that point if there is a risk for retaliation. And this is where our partnership with CRED comes in. If we determine from our risk assessment that there is that risk, then we're able to activate with CRED, and CRED's able to activate with the street outreach organizations to immediately start, and Jalen will talk about that, so I won't steal that thunder. It's been an incredible partnership with him and the other street outreach organizations to help mitigate the potential for retaliation. But at the same time, the violence recovery specialists are at that moment when an individual is most interested in engaging in support activities, helping to motivate that individual to receive, to accept services, whether it is behavioral health support. We've seen, and this seems like a small number, but nearly 25% of the individuals that our violence recovery specialists interact with accept behavioral health services. Now, we're in a community that less than 50% of the people access behavioral health services. And so if you can take this population and convince them to receive behavioral health services at a rate of 25%, the national rate is about 12%. That's pretty high.
Yep.
So that's very successful. We also have 40% of the patients that we engage with that accept the interventions, whether it's a work program with Ready, whether it's programs that Bright Star Community Outreach provide, whether basic needs that they have, our violence recovery specialists help them with housing, food. These are things, these social determinants of health, things that will mitigate some of the immediate needs that they have so that you can move them toward long-term recovery and long-term solutions. So our violence recovery program is really about getting an individual, moving them, planning toward long-term recovery. We have a case management focus in that program where our case managers, most of which are social workers, all of these individuals have had an experience with violence in their own lives. These social workers provide ongoing case management through the recovery period. There is no start and finish to the case management services that our violence recovery social workers do. They will work with that individual through the point of recovery. So this is a valuable program. We've served nearly 9,000 people, families, children, and individuals that have been impacted by violence themselves. And I'll say this is the last thing I'll say. The reason that the family is important and ensuring that this program serves a family is because that one individual that's been victimized by violence is not the only person impacted by that violence.
That's right.
That family member, they've suffered losses, they have fear, they experience post-traumatic and secondary traumatic stress. And so in order to heal that individual and move them toward recovery, you've got to work with the entire family and move that entire family toward recovery. So I'll stop there and let Jalen.
Well, you know, it's interesting because you can tell that there's a lot of partnership that goes on here because you're finishing each other's sentences and you know what you guys are working with, which I think is fantastic. And Jalen, I wonder if you could talk a little bit, because we're talking about holistic approaches. And that's when you talk about what CRED does, and then you talk about how you're interacting, as Brenda's been teeing up the concept of working on the violence recovery. How does all that work with your organization?
Yeah, so first and foremost, peace to everyone, and honored to be among you all. So first and foremost, I think it starts with the mission. So CRED's mission is a mission that each of our panelists both are committed to and believe in, a transformative reduction in gun violence across the city of Chicago. And so to that end, CRED's playing in a few important spaces. One, CRED's a funder, so we're funding violence reduction strategies on the ground in Black and Latinx communities alongside other private foundations. That's important. Also, CRED's doing some policy work, and so that part of it is really about significantly increasing the amount of public funding investments to violence reduction work. And then lastly, this direct services piece that we're talking about here is something, this is boots on the ground, and CRED is actually providing a range of holistic services. So we're talking about outreach and interruption services, on ground zero, working with the highest risk population, shooters, potential shooters on the ground. We're talking about life coaching. We're talking about clinical team. CRED has a clinical team as part of our street outreach team. And these are individuals that actually look like the community, and they have experience working with high-risk populations as well. We have employment and training. We have meaningful job placement opportunities for our young men and women. We have financial support, housing, but then also we're not just working with individuals, we're working with groups as well, the groups, cliques that they're affiliated with. We're working with the families, as Brenda talked about as well, which is critically important, but we're also doing programming focused on high-risk women and programming that's focused on high-risk youth. We're talking about your youth that might be between the ages 13 to 17, which has different needs than even our adult population of high-risk individuals. One thing I do want to say about the violence recovery team and this partnership with UCM, it's critical. It aligns with CRED's mission. It's a critical part of our strategy. The two things, that we focus on with that partnership is, one, preventing retaliation, which is imminent a lot of times. The minute somebody is shot and they enter the trauma center, the clock is ticking. And so with the MOU that we actually have with UCM, we're actually able to get direct access inside of the trauma center, inside of the hospital, and this did not stop even with the pandemic. We got access even during the pandemic, and we know during that time.
So you're on call.
Absolutely.
Yeah.
And there were more trauma activations, as you know, within the last couple of years. And so one thing I just want to share, a quick example, we had a young brother, one of our beloved brothers, shot in the hundreds out in Roseland, shot right on Michigan, shot multiple times. They didn't even think he made it. He arrived at UCM. We were already calling UCM. UCM was calling us. They got us direct access right away. We were able to talk with him. As soon as he came out of surgery, we were right there. You know what I mean? Talking to him. He was very influential individual. He was bent on retaliation. His guys was coming up to the hospital. They were at the hospital, outside the hospital, in the halls. We were talking to them. We had an opportunity for 2 weeks straight while he was at the hospital, engaging him, engaging his guys at the hospital, engaging the guys back at the block, engaging a group that was thought to have actually, did the shooting in the first place. we were working in concert with the university. What ended up happening is we actually ended up helping relocate him when he came home. It was just so hot, you know what I mean? But we still worked with the individuals from his group. It turned into probably about 5 other high-risk individuals being entered into our program for additional services, and we continue to provide the services to the victim as well. And then the group that actually did the initial shooting, we ended up establishing some relationships with them, and we're working with them to this day, and we've established like a non-aggression agreement, so there's peace between those two groups at this point.
Amazing.
Wow, very impressive story. Thank you for sharing all of that. Very, very impactful. If I can, I'd like to bring it over to Evelyn, because I think we've heard about the violence recovery side, and you have a program called the READY program.
Yes,
Which deals with a lot of also working hands-on issues. I wonder if you could talk to us about that.
absolutely. And so let me join everybody else in thanking you for the invitation to be among this esteemed group, and to President Alivisatos for deciding to do this work like you mean it. And it's really clear that that's the case, and so it was an easy yes to say, we'll be here this evening. So the story of Ready Chicago actually starts with partnerships. And specifically the University of Chicago's Crime Lab, and they were later joined by the Inclusive Economy Lab here, and about a dozen or so community-based organizations who worked with us to design about 5 years ago an intervention that was about identifying by name the men who were at the highest risk of being involved in violence, higher risk than anybody in the city, and even higher risk than anybody in their own neighborhood. And the idea was that we would go and individually knock on people's doors and make them an offer of just a different option for their life. And specifically that meant a job and cognitive behavioral therapy, full-time, paid, for 18 months. And we started that in 4 communities with a target of about 1,000 men. That was 5 years ago. Now, 5 years down the road, our community-based partners have engaged 1,600 men in the program. We have invested $9 million in wages. So this is guys come to work, $9 million going back to the
What kind of work are they doing?
They're doing what we call transitional jobs, so first jobs for almost all of them, doing things like community beautification, urban gardens, working in the animal care and control center, so kind of early entry-level work. The real point of it, though, is to get them to engage with us and do the cognitive behavioral therapy groups. And so in addition to investing $9 million in wages over the past 5 years for our men, we've also invested another $27 million in the community-based organizations that are serving those men. So making an economic investment into the community while we're trying to keep men safe, and importantly, testing to see whether this actually works to reduce shootings and homicides. One of the things that we've learned since we started, when you talk to the men, first of all, this is the first job that many of them have had. 60% of them, a little over 60% of them are fathers. So as Valerie was talking about intergenerational, their lives are gonna go in one direction or another. And what we're trying to do is change it so that what happens to them has a positive generational effect on their children. So 60+% have children, and they talked about the importance of them showing up to their job every day, the different way that their family members regard them. But by and large, universally, the most appreciated part of the program is the cognitive behavioral therapy groups. And we have just heard countless stories of the ways that that CBT, or cognitive behavioral therapy, has helped to change everything from their future orientation, their life goals, to how they acted in a heated moment, and to how they decided what they were going to do on any given Friday night. So that's what they got out of it. Like, I feel like a changed person because of those groups, as opposed to the job. But the job is kind of honoring the amount of time that we're asking of them. So so I'll just say one final thing about this, the partnership with the university. Nationally, we have almost no rigorous evidence about social interventions to reduce gun violence, especially as those interventions are implemented at the community level versus law enforcement. And when we designed READY from the start, we designed it to learn from it. And we really wanted to just generate new and rigorous evidence about what works with this particular population. Would this particular package of services reduce somebody's risk? And so in a few months, our University of Chicago research partners are going to be releasing the final results of their impact evaluation.
Over 5 years of work?
Over 4 years of work. And it will be the largest randomized control trial evaluation of this kind in the country. I have had a sneak peek at some of that data, enough to say that I am very excited to be able to tell the story of what we've learned over the past 4 years and then start thinking about what comes next. I will also say that there's, you've heard just already on this panel that there are so many different ways we can approach this problem. We haven't begun to do it all, and we haven't tested to see what's most effective. But more importantly, we haven't done it in a concentrated way, sustained over many years. And so there's still so much room for us to make a difference. I think interventions like this and any variation on this kind of intervention brings me a lot of hope.
Okay. It's so interesting as you listen to this discussion, and particularly yours, there are not quick solutions here, are there? These are very involved for everybody involved, sure. And not the least of which is the individuals that you're serving.
Right.
No quick solutions. Okay. Derek, I wonder if I can turn this over to you. You've been at the university for how many years now?
10 years.
10 years.
Believe it or not.
And during your tenure, the university's involvement in community engagement programs has really evolved quite a bit. And I wonder if you can talk about, where it started and where we kind of are today, because you're hearing about the connection with some of these things.
Yeah, sure. First of all, I just want to thank these phenomenal panelists for joining. This has been incredible for me to listen to, for me to learn from, and I think it's inspirational for us at the university to think about what we can do together. So I want to thank that and thank President Alavasalos for his leadership. What I would say is that when you to think about the way our approach to civic engagement and what that looks like, you're seeing it tonight. This is what the university civic engagement at its best looks like. Fundamentally, it's about looking at what are the assets of the university, the main strengths, and that's our research, our educational expertise, and we're also an economic anchor on the South Side. And it's thinking about how can you take those assets, partner with community stakeholders, and then direct those at a problem or at a challenge. And so if you think about the work that Deb and Pastor Harris, that's exactly what it is. It's the researcher getting together with the community-driven vision, going after an issue together, or what Brenda talked about, or what Evelyn talked about. And so I think that, to me, the idea, and hopefully what will come out of this, is we get more Deb and Pastor Harris partnerships. We get more Jalen and Brenda partnerships within the university. We have a tremendous amount of faculty, we have a tremendous amount of staff interested in these issues, working on these issues. Hopefully this will lead to a proliferation of activity around this topic. The other thing I would just say briefly is that another part of our civic engagement work is thinking about the various roles we can all play to support each other's work. And so an example of that is Brenda talked about the Violence Recovery Program, and they work with a lot of community-based organizations. My office runs a capacity building program for community-based organizations.
What is capacity building?
Capacity building, it's called the Community Programs Accelerator, and it's basically working with nonprofit organizations to help them become stronger, more sustainable organizations in delivering on their mission. It might be helping them with fundraising, helping them put together a strategic plan, helping them figure out how to put a board together. It's whatever the capacity needs are of the organization. And to deliver on this work, you need strong community-based organizations because they're on the front lines in their community. They have the respect, they have the trust. So when Brenda was doing this work, she actually approached us and said, we're working with a lot of community-based organizations, and one of the things that they need is capacity building. Will you all create a program where we could send our nonprofits to you and you can use your expertise to help strengthen those nonprofits? And so we did that partnership internally, and it played a big role, I think, in helping to support the work that Brenda did. It leveraged an asset that we had. So I think another part of the notion of civic engagement is how do we all work within the university and university community together to bring our own expertise, bring our own resources and ideas to move the ball forward on these issues.
Okay, terrific. A lot of work is going on. I wonder if I can come.
Paul, can I just?
Please do.
I want to ask, if I may, as I'm learning a lot here. I really want to ask Professor Christnev. I heard you once speak about a specific intervention and the difference that it made, and you gave some numbers to it. And I think we've talked about a lot of things here, which they sound right, but I wonder. But we've also talked about the importance of being rigorous, getting, some numbers out to see, well, what did this intervention do? How did it really work out? So I just wonder if I could ask you to, you've told me other examles, and I just want you to put it out there because it helps for me to know those numbers again.
Yeah, so I'll let Dean Deb, as we call her in the hood, I'll let her talk about the specific numbers, but I'll just build the foundation from what Derek just shared a moment ago about capacity building. Because let me just tell you, heretofore, before we got into these partnerships, we weren't having the conversations in the neighborhood that we're having now. We wasn't speaking the language, right? Brenda and Dean Polunsky and the University of Chicago Medicine came in, and then they connected us to Crown and Dean Deb. And I got to tell you, we knew that there were issues, but we didn't necessarily, we knew we needed to address them. We knew how to address them, but we didn't speak the language of the community and we are of the folks in this ecosystem. Beyond that, when you talk about capacity building, we went through that class, and we didn't know we needed a board. We didn't know, we just knew we had problems and we need to fix them. That was the bottom line. And so now we're talking about social determinants of health. We weren't saying that, right? And the folks here had to respect the knowledge base and the experience of the community.
Yeah.
We didn't speak their language, and they didn't speak ours. And so bringing us all to the same table to have conversations, it allowed them to respect us and allowed us to respect what their knowledge was. And so now the community, we sing in the song, in our community, we shouldn't ask for dollars without data. We shouldn't ask for money without metrics. And we shouldn't be trying to expand without evaluation. We didn't talk like that. No, we didn't. And neither did they understand the needs of the community. And that's what's been exciting. So we had the capacity building, and there's more of a need of that. That was our local organization. Now we talk about capacity building for the collaborative. And that collaborative has produced some amazing results. And Dean Deb, who is now in the hood, ironing tablecloths at events. That's unbelievable.
How does she do on that, by the way?
Say it again?
How does she do with that?
Need a little starch, but she did pretty good. She's amazing. The fact of the matter is she's welcomed into the community, and now the community is now welcomed on the campus. That is something extraordinarily different, and I think much more of that has to happen. But these results that President Oliver Santos is talking about is the real work, and the folks in the community who have done it, they certainly deserve tremendous applause for this.
Yeah, so, we talked, I talked in the very beginning about how we put together this community action plan. So unlike the randomized control trial of READY, this is an evaluation of all of those pieces of work together, looking at reductions of violence at the community level, not at individual levels. So through a rigorous evaluation, we've seen that since the start of the implementation of the Community Action Plan, we have significant reductions in across types of violence. We have a significant difference between similar neighborhoods in Chicago, a 14% drop in robberies, a 10% drop in aggravated assaults, and a 17% drop in shootings through this collaborative effort.
That's a big deal. And beyond that, people in our community were suffering from tremendous trauma as they are now. And I just want you to think about more than 50,000 people have been able to experience the work that we do around trauma, right? Since 7,000 people murdered in Chicago since January 2012. And we asked the question, who did or does the trauma counseling for those families, whether it be the victim's family or the perpetrator's family? In most cases, nobody, because Black and brown people, not exclusively, but specifically, they don't go to counseling for 4 reasons. They don't know, trust, or think they can afford counseling. And then number 4, the stigma. Nobody wants to be labeled crazy. But they still come and talk to people like me, the faith leader or the community leader. So we decided, and the Lord told me, identify, train, and certify faith and community leaders to provide trauma counseling based on that model from Israel that I found. We've done it. And now those folks called the helpline. Now 50,000 people are now trauma informed, and it is transformational. Now let me be clear as I land the plane. You know, if you think trauma was bad, we even talked to the young people in the surveys that we took in the various schools. 2015, we surveyed 19 schools. 2018, we surveyed 21 schools. That the first time we had I believe it was a 72% response rate. Second time, an 81% response rate. Listen, since the days of Tuskegee, you don't do research on Black people because of a lack of trust and a lack of relationship. But because of our partnership, we were able to do that. And what's amazing is, listen, I say 20, you don't have to cuss. Just say, I don't give a 2020. Everybody know exactly what you mean. 2020, 2021 has been rough. And if you think the data that showed 35% of those students showed clinical levels of depression, and in 2018, it was 50%. Imagine what it is right now after George Floyd, social unrest, COVID-19, all of the V's, the variant, the vaccine, as well as the virus. It's been tough, but we're excited that we're moving the needle and we're letting the community lead the effort, and that's why we're getting these kinds of results. So thank you for raising that, President.
Can I say how unusual this is? I mean, having seen it now at a national level and looking at the work we're doing in Chicago, to have the level of trust and true partnership, not a paper partnership, but one based in relationships where you've worked together over an extended period of time and you've approached an issue not in silos but rather holistically, that is unprecedented. And so that's why I think that the work that we are embarking on here in Chicago can really be a template for what should happen around the country. You have to have local leadership that's strong. You have to have evidence-based practices. You have to have large institutions that can provide an economic engine, whether it's the university or the Obama Center, that's going to help spur opportunity and create it. And you have to have people in the community who are willing to have honest, difficult conversations with one another, which you can only have in safe spaces, as the one you've created here tonight, and where we have a listening audience from all over the city who I hope is feeling what we feel, which is that level of pragmatism, but also optimism.
Let me ask you a
And
question
hard work.
on that optimism question. And I want to be able to pull in a question from some of the viewers that are here tonight. We're still we have optimism in some ways, but we're still in a really tough situation here. And I think this question of, as we look at the headlines every day, what is giving us hope? It would be very easy to be discouraged and to feel like we're not making progress, but there's hope in this conversation. What's giving you guys hope?
Well, I don't mind jumping out. Imagine Chicago without the work we do.
Right.
Start there, right? And a lot of people say, you know, we're all in the same boat. That is a lie. We're all in the same storm, but we're not in the same boat. Because if in this situation you're on a yacht and I'm on a canoe, That's not the same boat. So that's the first thing. The second thing is you now see a community willing to step up and heal itself. And I say this all the time, we don't need people to helicopter in and save us. Give us the training and the tools and the resources. We're pretty resilient people. We will save ourselves. But you have to have those particular things, and finding other partners that may not look like us and may not live like us, who want to be a part of what we're doing for us, that is really exciting, and that's what gives me hope.
Okay, Jalen, how about on your side?
Yeah, I mean, I would say a couple of things. First, I do just want to add just one point to the small group thing. I mean, we've had an opportunity to work with a few groups: Chicago Youth Boxing Club out in Little Village, Inglewood First Responders in Inglewood, obviously, and then Black Men United in North Lawndale. There's a lot of small organizations that they're not able to compete for funds, but they're doing some great work, and their heart is in it. And so that small capacity building is critically important. The thing that's given me hope, there's a lot of things that are actually working in different corners of the city.
Okay.
They haven't been scaled. We haven't been able to really, give them the proper investments over time. But I think some of those are giving me a lot of hope, and I'll just raise one. I think a lot of times when we think about the highest risk, we think about how we can actually serve them as like program participants, give them services. But a missing piece is how can we actually empower them to be part of the peacemaking process? And that's what we've seen like with programs like FLIP, when we're actually able to empower and train high-risk individuals to actually and incentivize them to maintain peace in their own areas. And this is something, and we talk about numbers, we actually saw from some of the data analysis there, 85 to 90% of those hotspot areas, and we're talking like 75 hotspot areas, saw 0 victimizations when these guys were out there. And so that's serious. A lot of these are younger as well, high-risk individuals with that profile, people that a lot of people have already written off, people that are on police radar, and they're being utilized to actually police their own communities. That's giving me a lot of hope.
You know, as we have a couple minutes left, and for folks maybe not knowing what they were going to turn into, this was not going to be a hand-wringing, what do we do situation. I think folks are tuning in, they're hearing things, they're seeing impact. Where do we go from here? Say we're getting back together in 6 months, President Al-Assado's a year. Where are we taking ourselves from here? And what does this group need to continue working on?
Wow. Well, first of all, let me just say how inspiring it is to sit here. To me, I think about University of Chicago is a very special place in the world. It's a place where people really, the scholars, the faculty, students, and many others come together, and we really try to understand things at the deepest level we possibly can, whether it's the origin of the universe or the latest economic theory. All of that is happening here. But what we see here tonight, which I think is very special, is how that way of asking questions, fierce debate, all of that, now you see what happens when it turns to a partnership with our neighbors and our community members to do something in the world that's desperately needed. And how happy it makes me to hear about aspects of this partnership. UChicago Medicine, among the finest places in the world for an academically driven medical center, great discoveries in medicine every day. To see it now come into a partnership around doing something that's significant to make a difference in the lives of our community, that's a very special thing to see. And I'm seeing that here with this long-term partnership, 17% reduction in shootings. That's a big deal.
It is.
And it's one program, and it's a sustained program, some awfully amazing people doing this, but think of what happens if we really think together, we recruit other partners, and we try to do it at scale even better. There's so much that can happen. So I'm just heartened by this, and it leaves me feeling like the fund I announced tonight is one we're going to refine, And then we're going to try to see what are other things that we can do after to build on that. So I do hope that listeners come away feeling like the university is a partner in trying to address these issues in the deepest way possible, and that there are paths for us to make progress on these issues when we work in that way.
Terrific, thank you. This conversation played a lot. It was both scary, it was educational and inspiring, all kind of wrapping up into a lot of dialogue. We've got a lot more to talk about, but I think we've run out of time. I want to thank all of you for coming together and sharing these thoughts and your stories and the experiences. And for the folks that have been watching, thank you for joining and for learning. And we've got a lot more to work on and to hopefully report some continued progress in. So thank you, everybody, and have a good evening.
Thank you.
Thank you.
Thank you.
Thank you very much.
Good job.
Oh, thank you.
Thank you.